Now that Stu and I had awkwardly agreed to become potential future co-parents by putting embryos on ice, the question was where we would be putting these embryos. Where should I go to freeze? In New York, it's a paradox of choice. Within 10 miles of me, there were more than 24 clinics. I felt paralyzed. This seemed like a big decision. I'd talked to so many women who had drained their savings accounts to walk away with nothing. How could I make sure that I was giving us the best chance for success? As a woman in her mid-30s, I had long been swimming in targeted content for fertility clinics.
Meet Modern Fertility, the test that teaches you about your eggs and fertility hormones. Today, 1 in 6 couples has trouble conceiving, so we built an easy way to test fertility hormones before you're ready for kids.
Progeny is a leading provider of fertility benefits. Our mission is to help people build their families.
Introducing KindBody, a new generation of women's health and fertility care, with a redesigned patient experience that's accessible and intuitive.
This last one, KindBody, it stood out to me. KindBody came on my radar a couple of years ago when they opened a location in the Bay Area, where I was living at the time. I went to their opening party. There was this faux flower arch in the entryway and giant gold balloons that spelled out KindBody. Champagne, of course. And there were a lot of women like me, 30s, professional, Madewell jeans and black ankle boots. And I'll admit it, I wasn't just there as a reporter. This was right after that bad breakup I talked about in episode 1. Fast forward a few years later, I'm now thinking seriously about freezing embryos. And I'm curious about KindBody. The company's pitch is that it's trying to make fertility more friendly and accessible and affordable. The fertility industry has a bad rap. For KindBody, that presents an opportunity. It stands out from its competitors. Venture capital and private equity has poured into this space in the last 5 years. 2023 was a record year for fertility VC deals. KindBody was the largest of those deals. It's drawn celebrity investors like Gwyneth Paltrow and Gabrielle Union. It's raised more than $300 million and opened 35 clinics. But as I looked closer, it seemed like KindBody's rapid rise was also illuminating cracks in the system. I'm Kristen V. Brown, and this is Misconception. When you walk into KindBody's New York City flagship, it feels a bit like a high-end salon. It's in a storefront on a trendy part of Fifth Avenue. There are plush couches with yellow throw pillows in artful disarray, high ceilings with ornate columns, a display of vitamins topped with an overflowing floral arrangement.
Hopefully it doesn't look like your typical doctor's office.
No doctor I have ever been to. KindBody's founding physician, Fahima Sassan, gave me a tour. She told me that the aesthetics play directly into KindBody's mission. It's hard to even compare KindBody to Mate, which I visited in episode 2. Mate looked like a doctor's office.
As you walk through, intentionally, there's no white coats. There are no degrees on the walls. Our clinics are really intentionally built to be a blank slate for our patients. And so we're here to be a partner in your journey, not that you're coming to our shrine. And
this kind of visibility brings in business. The company even has a big yellow van that roams the streets of cities, offering fertility testing for cheap or even free, as a way to get women in the door. Accessibility is also key to KindBody's strategy. The company pitches employers to offer fertility care as a benefit. In 2022, for example, they struck a big deal with Walmart.
Walmart employs more than 2.2 million workers and is teaming up with the fertility startup KindBody to offer employees access to more than 30 fertility clinics and IVF labs across the U.S.
It's opening up a brand new facility in Northwest Arkansas.
We say we want to do good by doing well. And so you do good by bringing down the cost of care to make it more affordable to more people. We want to democratize care. That's been our mission since the beginning.
That's KindBody's founder and CEO, Gina Bartese. I told her that KindBody had first caught my attention because of its big egg freezing push a few years ago.
The place you start when you're building a fertility company, in my opinion, is you start with egg freezing because they have discretionary income. Those women that are thinking about egg freezing are not asking about success rates. The IVF cases come later.
This strategy seems to be working for KindBody. This May, it opened a clinic in the ritzy Newport Beach, California, and plans to open more in Charlotte, Miami, and San Diego before the end of the year. The company told me that since 2022, the number of new patient visits has increased by 75%. It has also nearly doubled the number of employers who offer Kindbody as a benefit. It expects to get 4,500 women pregnant this year. They call the babies born at Kindbody kind babies. In other words, at Kindbody, business appears to be booming. Multiple clinics that I interviewed told me that this sort of growth and investment is good for patients, that cost savings and better quality care gets passed on to patients when clinics are able to expand into big nationwide clinic chains, like Kindbody. And at least on the surface, Kindbody had something very appealing to offer. Who doesn't want to feel like they're going to a spa appointment instead of the doctor? We'll be right back. After my initial fertility testing, way back in episode 1, I made an appointment at Kindbody for a freezing consultation. Based on the state of my fertility, I wanted to know what to expect if I froze. My appointment, coincidentally, happened to be with Nicole Noyes, who we heard from in episode 1. She was the pioneering doctor who helped take egg freezing mainstream. She was working there at the time. Kindbody has a little calculator in its app, which it says it built using clinical research. With my numbers, it estimated that I might need 3 or even 4 egg retrievals to get the desired 20 egg number. Kindbody, for the record, said the calculator was just meant to, quote, empower patients with information, rather than offer concrete clinical guidance. Nicole sounded more optimistic. She said 2 cycles was all I would likely need. I told her I would think about it. The next day, I checked my inbox. There was a flurry of messages from Kindbody. I'd been signed up for the start of my egg freezing journey. I had just 9 simple steps to complete. There was an email about cost and another email asking if I had any questions. Then, the next day, a nurse called me. I told her I was confused why anyone was calling me at all because, as I had told Nicole, I wasn't sure what I was going to do or whether I was going to do it with Kindbody. Over the next few months, I got countless emails urging me to do things like join the summer freeze for 25% off. On the Kindbody app, I could just add a $7,500 egg freezing cycle to my shopping cart and check out, like I was impulse buying a pair of very expensive shoes. It reminded me of this Kindbody info session I had watched a few weeks earlier.
We want no regrets here. We can't go back in time. And we want to make sure that you have all options available to you. But the longer you wait to come in, so those options start to dwindle.
Kindbody's IVF prices ranged from about $14,000 to $16,000, excluding medication, and depending on location. Its New York prices were on par with what I saw at other clinics in the city. And all of those prices were higher than the average price for an IVF cycle in the U.S., which is about $12,000, according to Fertility IQ. I told Pasquale Patrizio about my experience at Kindbody and asked him what he thought about it. He's the chief of the Center for Reproductive Medicine and Infertility at the University of Miami, and he studied the effect of private funding on the industry.
For me, what is really not correct, it's the pressure. The fact that the next day you already got an email and messages from the clinic saying, okay, are you ready to start? Well, you already told them, listen, I want to think about. But now they are already contacting you within 24 hours. That's already a pressure for you to do something that they start to put you in the regret that if you don't do it, you are really losing the opportunity out and you have now these guilty feelings. And so it's a kind of a psychological maneuvering.
When I told Kindbody about my experience, they said the idea that it's pressuring patients is categorically false. While it does engage in marketing campaigns like seasonal promotions, Kindbody said that's standard across the industry. And they're right. It is standard. We talked about some of those practices in an earlier episode. Across the industry, Pasquale told me, clinics are often under pressure to appease investors, so they push treatments on patients. He wasn't speaking specifically about Kindbody. Big fertility clinic chains could, in theory, save consumers money and make treatments more accessible by leveraging their market power and lobbying for policy change.
So theoretically, by doing more volume, you should also be able to offer less costly, should be cheaper, should be more economical. But this potentially cost saving have not been passed on to patients or to payers if you are working in a state with insurance that are covering.
Actually, by my calculations, when you adjust for inflation and include things like the cost of medication, IVF has gotten more expensive in the U.S. over the last few decades, not cheaper.
Are we doing good for patients? or is the patient lost into these business transactions?
This tension between the bottom line and the patient, it's existed for a long time. It goes back to how IVF came up in America. Attempts to create special regulations for IVF have failed time after time. And a lot of that has to do with interference from the anti-abortion movement. Around the same time IVF scientists were making big breakthroughs, the Supreme Court passed Roe v. Wade, which revved up anti-abortion activism. These activists also opposed IVF, viewing the destruction of embryos in the course of IVF the same as abortion. Their growing political force made lawmakers hesitant to weigh in on IVF, even as countries like the UK were creating new regulatory agencies for it. It also led to a ban of federal embryo research funding. There's also not widespread health insurance in fertility. Insurers normally weigh in on the best treatments. In IVF, patients are mostly left to figure out for themselves whether their doctor is telling them something they need is really something they need, or whether they're being upsold. All that means fertility medicine grew up as a business, a marketplace where clinics can charge people tens of thousands of dollars to start a family. And as the industry has rapidly expanded, the scale of issues, it's grown too. We'll be right back. Not long after I started reporting this podcast, my colleague Jackie Davalos and I both started hearing from people that there were problems at Kindbody that weren't quite as visible as what I had experienced.
I had gotten a tip from a user on Reddit that was commenting on kind of their experience at the company. They were a former employee, and they basically told me, you should really look into those laboratories where these IVF treatments are really happening.
She found that there had been a handful of incidents, particularly after the acquisition of another fertility clinic chain.
Embryos had been mishandled as a result of understaffing and inconsistent lab protocols. 3 of these accidents occurred in Kindbody's Bryant Park lab in New York City, including one where a patient's last embryo was damaged after accidentally being left out in room temperature. Another incident occurred in a Kindbody clinic in Chicago, where staff couldn't find a patient's embryo.
The patient wanted her embryo genetically tested, but staff couldn't find it when they looked where records indicated it should have been.
It was eventually found, but staff had to rifle through cryo tanks to find it.
Kindbody told us that these incidents were a fraction of the more than 7,000 freezing and IVF procedures that they've handled. The company said its incident rate is 0.2%, on par with the rate found in a 2018 study. They said they weren't understaffed, and they disputed that there was an escalation in lab issues as the company grew. Some of the employees I talked to actually said that even though Kindbody's labs did face some issues, the equipment and standards at Kindbody were much better than in other clinics where they'd worked. Issues and accidents in the lab are by no means unique to any one clinic. They're happening across the industry. There have been other allegations of things going wrong, like a recent lawsuit that alleges a California clinic called Ovation Fertility destroyed embryos belonging to at least 11 people when an incubator was cleaned with hydrogen peroxide. The suit says that the clinic went ahead with transferring the ruined embryos for pregnancy, not realizing what had happened. A spokesperson for the company said it was an isolated incident which impacted a very small number of patients, and that the company will continue to implement and enforce rigorous protocols to keep patients safe. And then there are the cases that have serious ramifications beyond what happens at any one facility. In Alabama, for example, several patients sued a fertility clinic after a hospital patient wandered into the room where their embryos were being stored and took them out of the freezer, destroying them. The case went all the way to the state Supreme Court, which ruled in February that the patients could sue the clinic for wrongful death because their embryos were children. That decision temporarily halted IVF procedures at clinics across the state, with clinicians worrying they could be sued or worse anytime something happened to an embryo in the normal course of treatment. But it also put a giant national spotlight on problems that can occur away from patients' eyes in IVF labs.
The issue of fertility misconduct, injuries, mishaps at fertility clinics, and, almost always in the labs of fertility clinics, is a much larger issue than any of us knows, including myself.
This is Adam Wolf. He's an attorney, and when it comes to fertility industry shenanigans, he's kind of seen it all.
I cannot tell you the real scope of this problem because there is no reporting requirements. There is no central database. There is nothing that the public can turn to understand the scope or magnitude of the problem of fertility center misconduct.
Not long after he took his first fertility case, he started getting a ton of calls.
We started getting phone calls from other people, folks who said, oh, my embryos were also dropped on the ground. My clinic also lost our embryos. Our clinic transferred the wrong embryos to us. You know, the list can go on and on.
He developed a bit of a reputation for these cases.
Attorney Adam Wolf tells CBS News he plans to file a class action lawsuit against the San Francisco clinic this week on behalf of the patients. He also filed a second lawsuit against the Ahuja Medical Center outside Cleveland.
Adam's firm even purchased the domain lostembryos.com. Adam says he's handled more than 1,000 fertility mishap and misconduct cases over the last decade or so. In one of his biggest cases, in 2018, more than 3,500 eggs, embryos, and other genetic material were lost when a cryotank failed at Pacific Fertility Center in San Francisco. His firm represented about 100 patients. A jury awarded 5 patients nearly $15 million. That verdict was appealed and eventually settled out of court. But I heard this a lot when talking to him.
I'm not allowed to talk about it.
Adam can't talk about a lot of his cases because they settle.
And I would say in 80 or 90% of our cases, we never even file a lawsuit because it is settled with the clinic on terms that include confidentiality, such that the public never finds out about it.
This is why we really have no idea how common these kinds of mistakes are. Clinics are required to report their success rates, but they aren't required to report their errors. A 2020 study found 133 lawsuits were filed in the previous decade over lost, discarded, or damaged frozen embryos. But that is probably only a fraction of cases. Adam's caseload alone seems to prove that. Adam says that a lot of the time, what goes wrong is a genuine accident.
A lab tech looks up, thinking about what movie he or she is going to see that night and just mixes up embryo 1 and 2. Or there's a labeling problem and, couple A's embryo is either not labeled or labeled with the names of couple B. Right? And you could see how that can happen. You can. People make mistakes. I get it.
Sometimes, of course, it's more nefarious than that. You've probably heard about people doing 23andMe and finding out that they have all these siblings they'd never heard of because a doctor covertly impregnated his own patients. All of this is part of why industry critics lobby for more regulation. They argue that fewer federal research dollars and sparse insurance coverage has let business decisions become a major driving force in setting practice standards. So, the argument goes, we need more regulation to prevent that. One expert suggested fertility clinics should be treated like hospitals, which are required to report so-called never events, the kind of stuff that should never happen, like leaving a sponge in a patient during surgery or perhaps implanting the wrong embryo in someone. People who work in the industry argue that it does have the proper amount of oversight.
The labs are very regulated. In order to be having a laboratory that are going to perform embryology work, they need to be CAP inspected, which is the College of American Pathologists. They need to be a CLIA inspected. The FDA also comes and does surprise visits as an average every 2 years.
All the same rules apply to fertility doctors and labs that apply to any medical doctors or labs in the U.S. Most clinics are also members of industry groups that have their own sets of standards. Other countries do set more rules for fertility practices, though. The UK, for example, has a special regulatory body just for fertility clinics. They have to get a special license and follow all the guidelines in a 330-page rule book, including requiring 2 people to always ID embryos when they're moving around a lab, so there are no mix-ups. There are no specific national fertility clinic regulations like that in the U.S.
We need to have checks and balances in the labs of fertility clinics that greatly minimize and hopefully eradicate those types of errors.
He wasn't talking about any one specific clinic, but one thing that really struck me was that his cases are often against high-volume clinics.
They're just doing a ton of procedures, and it's all happening very quickly, and there's pressure to get it done, and it leads to mistakes. Even if those clinics have proper standard operating procedures or SOPs, they're often not followed.
This explains why we are hearing about more and more of these mistakes as clinics backed by venture capital and private equity are under pressure to dial up the volume. And patients don't have much insight into that side of things. They have no way of knowing if their clinic has settled a ton of lawsuits that never made it into the public eye. As I considered where I should freeze my own embryos, I kept thinking about this. I like to make decisions based on data, and most of the data I wanted was either non-existent or not that reassuring. There still wasn't much data on women who had returned after freezing their eggs. One recent NYU study found that just 39% of women who did try to use their eggs wound up having a baby, though that number was higher if you were under 38, like me. Eventually, I decided to freeze my eggs at NYU. It was a pioneer in egg freezing and still does a lot of freezing research. It had a good IVF success rate, according to CDC data that I looked at. After going off birth control and waiting a few months, it was finally time to start my freezing cycle. A box of drugs the size of a big beach cooler arrived at my apartment. Inside were all the supplies I would need to rev up my reproductive system. 4 types of hormones and a shit ton of needles.
Hold the pen in one hand and with the other hand, pinch a fold of skin around the injection area.
Okay, it's the big boy. Have my gauze pad ready. Should I just count? Okay, 1, 2, 3. Nope, I still didn't go. Okay, I'm not ready. Gonna watch it one more time.
Insert the entire needle straight into the skin at a 45 to 90 degree angle. Press the dose knob down as far as it will go.
Okay, I think I'm ready. 1, 2, 3. I was in it now. The dose reads 0, so I guess I did it right. I fucking did it right. Every morning and night, I was stabbing myself in the stomach with 2 long needles full of hormones that would make my body's egg production go into hyperdrive. It's day 2. Gonna try this whole injection thing. Hopefully it's slightly less frustrating than it was yesterday. Day 3. There we go. Okay. Second vial of drugs. Ow. I don't know what I did on Saturday. Does that make this day 4 of my cycle? I think I might be off book, but I'm terrified of screwing up, so I'm just gonna watch the video quickly before I do it. Day 5 of my fertility cycle. Oh, fuck. I just dropped the needle. Okay, it's okay. I think I can sterilize it. I was responding well to the drugs, but I was also so tired and bloated and just generally feeling like crap. 8th day of my cycle. The tiredness is really what's killing me at this point. Mix, 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 mix. Needle is ready. Never gets easier. It wouldn't be long before I would know whether this crazy bet would actually pay off.
So, are you ready for it?
Yeah, what's the news? Tell me.
That's next time on the final episode of Misconception. This series was written and reported by me, Kristen V. Brown. It was produced by Gilda DeCarli and Stacey Wong and edited by Cynthia Coons. Additional research was done by Tanaz McJani. It was engineered by Blake Maples. Our theme music was composed and performed by Hannes Brown. Special thanks to Shelley Banjo, Randy Shapiro, Anna Mazarakis, Jeff Grocott, Laura Zelenko, and Creighton Harrison. Sage Bauman is Bloomberg's head of podcasts. Thanks for listening. If you want to binge the whole series early, go to Bloomberg.com and hit subscribe. Then connect your Bloomberg.com subscription to Apple Podcasts. Or listen as we release a new episode each week. See you next time.